Let's get started. I want to start by thanking the band for a fantastic start. I hope we'll be hearing some more Bruno Mars and some Uptown Funk. That was fantastic. Great, guys. So welcome to the 8th MGPO dinner. My name is Tom Lynch. I'm the chairman and CEO of the Massachusetts General Hospital Physicians Organization, and I could not be happier to be here today for this fabulous event. I want to start off by recognizing a number of key people who are here who help make the work of the MGPO and the hospital work so well. First, a number of our trustees are here in attendance. Laura Barker-Morse. Laura, if you could just stand. John Deutsch. Art Goldstein. Pam Reeve. Peter Greenspan. Ron Kleinman. And last but not least, someone who serves as a member of the MGPO board and is also the chairman of the board of the Massachusetts General Hospital, Kathy Minahan. Kathy, thank you very much. Now, I think we call this the MGPO dinner, but everybody knows this is the McGovern Awards dinner. It always has been the McGovern Awards dinner, and it always will be the McGovern Awards dinner. And tonight, I'd like to start off by thanking the McGovern family who are here with us tonight. First, I want to thank Ann Jennings. Ann, the wife of Brian McGovern. And I also want to introduce Katrina McGovern, who is just finishing up her 4th year at Harvard Medical School, and next year will be at Boston Children's Hospital as an intern. Congratulations, Katrina. And Katrina, I can say for those of us who are here who knew your dad would be incredibly proud of everything you've done. Congratulations. I also want to take an opportunity to thank 2 people who are responsible for the night actually happening, and that is Jackie Stepanian and Ira Stepanian, who have endowed the McGovern Awards and the McGovern Awards dinner. I want to thank them for their support of the physicians at Massachusetts General Hospital. Jackie and Ira, thank you so much. If you could please stand. Now, this is an interesting job because I am the first person to hold this job in 12 years, okay? Which means that there are a number of people, in fact, everyone who's ever held this job is here tonight. And we could not be happier to introduce the 3 previous chairmen and CEOs of the MGH. I want to start with the founder of the Massachusetts General Physicians Organization, Dr. Jerry Austin. Jerry, please stand up. Now, I will leave it to Torch and Peter to debate whether this is true. But Jerry, your role in shaping the vision of the MGPO is everlasting. And for those of you who don't know this, there is still not a single decision made at either the Massachusetts General Hospital or the MGPO that Jerry doesn't have his hands on. So Jerry, thank you very much. And next, I want to thank my predecessor. When I came for this job, people said, you know, Tom, you got big shoes to fill, and we're not talking literally. You'll be following someone who is adored by the medical staff at MGH, who has a keen sense of strategy, and who led the MGPO through one of its most important periods of growth. I'd like to take this opportunity to introduce and to recognize the CEO and chairman of Partners Healthcare, Dr. David Torchiana. Torch. And finally, I'd like to introduce, for remarks, the person who held the job in between Peter and Torch, Dr. Peter Slavin. Dr. Slavin is the president of the Massachusetts General Hospital. He has been a visionary who has led this hospital to the greatest heights one could imagine. And you're going to hear specifically some of the remarkable accomplishments that we've had just over the past 6 months. Peter.
Good evening, everyone. It's really a joy to be here, and aren't we fortunate to have convinced Tom Lynch to come back from Yale to head up the MGPO. Tom, it's great to have you back. It's really great to see so many colleagues all assembled in one room from every department within the institution. And if there were 2 words that you could remember from my remarks tonight, they would be thank you. Thank you for everything that each and every one of you does to care for your patients and advance the other important missions of this institution. I strongly believe that there's no greater collection of physicians in the world than the medical staff of Mass General Hospital and the members of the MGPO. And there's also no hospital in the world and medical staff that enjoys a better, more constructive relationship with one another than this hospital and the physicians. So thank you so much for all of that. So please give yourself a round of applause. As you all know, through your work, we pursue 4 missions every day and every night. Those missions are clinical care, research, education, and community health. And in the last year, we have received some remarkable recognitions in each of those 4 areas. And as you also know, at the MGH, we don't like to brag about our work. We like to just sort of get the work done, and once it's done, focus on the next work. But I just want, on your behalf, to sort of brag about the accomplishments of our medical staff and the hospital. Certainly on the clinical side, the most widely recognized measure or recognition for clinical excellence are the U.S. News rankings, and for the second time in 4 years, Mass General Hospital was ranked #1 in the United States. So thank you and congratulations for that. As far as our research mission goes, we have known for a while that we have the largest hospital-based research program in the country, that we get more NIH dollars than any other hospital in the country. But just about a week ago, Nature Index published an article and an analysis looking at the scientific impact of healthcare institutions across the world based on publications that emanated from them. And as some of you may have seen, and as I'm pleased to report, their analysis showed that Mass General Hospital had the most scientific impact of any healthcare organization in the world. So congratulations to you for that. On the educational side, medical education, it's hard to find great measures, but I think arguably the best one that's out there at the moment comes from a startup company in San Francisco called Doximity, which has an app that 70% of the physicians in the United States have signed up on. And they recently, within the last 6 months, surveyed physicians across the country and asked them what was the best place in the United States to train. And the #1 hospital in that ranking was Mass General Hospital. So congratulations to you for that. And finally, community health, which, as you know, in many ways was our first mission. I had the honor last week of traveling down to Washington to accept the Foster McGaw Award. That is an award given annually by the American Hospital Association to the hospital they believe in this country has the best community health program. And so we, at least this year, we're #1 in community health as well. So congratulations to you for that. So to get such recognition in all 4 of our mission areas, I think is the hospital equivalent of winning the Grand Slam in tennis or golf. I don't think it's ever been done before. and it probably will never be done again. And I guess the only downside of this is that there's only one way to go from here. But I want to thank you for the contributions that each and every one of you make to your practices, to your research, and to the mission of this great institution. None of this would happen without our incredible medical staff. And I hope you enjoy the rest of the evening. And it's really an honor for me to work with you. Thank you.
Okay, so the PO. First, who owns the Grand Slam? The Grand Slam that Peter just told you about. The Grand Slam of accomplishments in patient care, research, community engagement, and education. You own the Grand Slam. And who are you? You are the doctors of the MGPO who work and toil and bring care to our patients, who discover new innovations, and who improve the health of our population. You own the Grand Slam. Who else owns the Grand Slam? The people who are here tonight supporting you. Your husband, your wife, your partner, your son, your daughter, your parents. The love and support of all of our families are crucial to our success. I'd like to see a round of applause for those people who are here tonight supporting us. So one thing I like to talk to Marcella Del Carmen, who's our new medical director, and Marcella and I are thinking about ways that we can get off of Bullfinch 2 and not just be on Bullfinch 2. And so we've started a series of lunches, and many of you in this room might have come to one of our MGPO lunches. And we ask everyone to say, what do we do well and what can we do better? So when you think about it, the themes that we hear at these lunches are pretty consistent. The first is, what do we do best? The MGPO puts patients first. Our doctors put patients first. Second, and this is probably the most common comment, everyone helps me. Whether it's for research, whether it's a patient to be seen late at night or early in the morning, whether it's for education, whether it's for our community mission, we all get together and help and support each other. And we also support each other to create great teams, because we all know that medicine is no longer a solo sport. But then you ask, well, what can we do better? I think we all recognize we can relieve administrative burden better. We know that the burden of documenting and processing much of the process of our care has changed the course of medicine. And we have David Ting working on our Kitty Hawk project to try to make the way we interact with patients more seamless and more patient-focused. Second, and this is a comment we hear a lot, is people strive to find balance in their lives. And I think about a comment that was made by one of the people who's here tonight, and she was at the last McGovern dinner, and she said, you know, Dr. Lynch, she said, I just don't think I'll ever win a McGovern Award because I'm not there at 10:30 at night rounding on the patients. I got family responsibilities at home, and I'm not going to be there at 10:30 at night. And we need to recognize that we need to work harder, all of us, to find balance in our lives to support the missions that we have personally as well as the missions that we have professionally. And I'd say third is the importance of getting outside of our departments and meeting and engaging with more people than just the cancer center or just the cardiology division or just orthopedics or just radiology. When you think about how medicine was practiced 20 and 30 years ago, all the doctors in the hospital would have lunch together every day from 12 till 1, and they would get to meet and connect with each other. We need to find ways to connect with each other, and tonight at the McGovern dinner, this is a great example of that happening. Now we know that medicine is changing at an alarming pace. We have EMRs. We often don't even go to the hospital. We spend our time taking care of patients in the office. And we know that technology has done two things. Technology has forced us all to ultra-specialize to some degree Even primary care doctors have specialized in a way that non-primary care doctors don't necessarily understand what they do in a given day. And it's intimidating for us to keep up with all the technology in all of our areas. And the forces of change in medicine can disconnect us from both our patients and from each other. And this forces us to ask a couple of questions tonight. Why do we want to continue practicing medicine? And Katrina, you've just signed up for a residency, so hopefully the answer is you still want to. And how do we move on, and how do we continue to make this better? And I want to say that some people would say, well, it's changing too fast. I need to pull back. I need to retreat. Maybe this isn't the right career. But that's never been the MGH answer. That's never been the way this hospital and the physicians of this hospital have responded to change and challenge. Think back to 1942. The White Building was brand new, and the Coconut Grove fire happened. Right at that time, the MGH sprung into action and provided care to patients who either survived or did not survive the Coconut Grove fire in 1942. Think back to 2013, when our brand new London emergency room opened at the time that the marathon bombings happened. And the MGH doctors and hospitals sprung into action to help the patients who survived and did not survive that difficult day. And it's a night like tonight that brings us together, and as Marcella was saying at the lunch this week, it allows us to celebrate the joy that's still in medicine, despite EPIC, despite meaningful use, despite needing to fill out all kinds of forms. What we do still brings us joy. And Katrina, as you begin your medical career, I hope you find the same joy in medicine that your dad did. So, a couple of things I want to finish with. I just want to remind people what the 6 pillars of the MGPO are that define our core values. What are our core values? And this comes down to, how do you get that grand slam? The grand slam does not come easily. The grand slam happens because of the 6 core values of the MGPO. The first is that we commit ourselves to outstanding patient care. And this is embodied in the work of all the McGovern Award winners who are here with us tonight, and we'll recognize them after dinner. It's in the work of Steve McAfee and his work in the Bone Marrow Transplant Center. It's in the work of Michelle Specht in the breast department and doing breast surgery at MGH. It's in the work of Nancy Wee in the Department of Diabetes and the Department of Endocrinology, taking care of patients with diabetes and learning how to change the way we manage this disease. It's in the work of Walter O'Donnell in the MICU, who works hard to bring the very best acute care to our patients. You don't get the Grand Slam without a commitment to quality and safety. I want to thank Liz Mort for all the work she's done, but I also want to thank all the department quality and safety officers who are part of the mission of enhancing quality and safety at MGH. This year, our most recent HCAHPS scores showed that 91% of people would recommend the MGH to their friends and colleagues who needed an acute care hospital. This is an unprecedented level of confidence in what we do at the hospital. The Grand Slam also wouldn't happen without innovation. It wouldn't happen without the innovation that Emory Brown brings to personalizing the care of patients with anesthesia, or the care that Ramnik Xavier brings in defining how the microbiome impacts our autoimmune system and how we develop disease. It wouldn't happen without Becca Heist finding new ways to treat patients with advanced lung cancer. The Grand Slam also means that we've got to recognize that in this day and age, we need to deliver value-based care. Tim Ferriss, who's here tonight, and our population team have begun to bend the cost curve and have begun to give rationality to the way we spend the limited resources we have. Our top care, primary care effort, Eric Weil is here tonight, who spent so much time on this. They've achieved exceptional prevention outcomes for cancer, diabetes, and heart disease. And the Grand Slam also means supporting our docs. I think about something Alexa Kimball has said, and Alexa said that it's very important that we own Epic rather than having Epic own us. Okay? And finally, I think one of the things that Peter mentioned about the community engagement, this is absolutely essential, is that community engagement is something we can be especially proud of. As everyone knows, the opiate addiction in this state is at epidemic levels, and people like Sarah Wakeman are working to try to deliver better ways of treating patients who are addicted to opiates. And I think another example of our community commitment is the fact that the MGPO allows all of our doctors to care for patients regardless of their insurance plan, lack of insurance plan, or coverage. That's not something that we should take for granted, and it's something we will work very hard to ensure. So tonight, with the awarding of the McGovern Awards, we are here to celebrate the joy that's in medicine. The Grand Slam, you did it. The Grand Slam, you own it. The Grand Slam, we will continue to do better, and our best days are ahead of us. Thank you very much. Enjoy dinner, and after dinner, we will have a video and we will award the McGovern Awards. Thank you.